proceed, let us briefly outline the format of this debate. There is one team from each batch with two participants, one speaking for the motion and one against the motion.
Each speaker will be given 2 minutes for presentation, following a rebuttal session for 1 minute.
The co-timing of the speech will not include any introductory part.
The first bell will ring at 1 minute 30 seconds and final bell at 2 minutes. Exceeding the time limit would lead to penalization.
No use of unparliamentary or unethical language is allowed.
Points will be awarded on the basis of speech, delivery, content, and question and answer session. No points for asking questions. If no questions are asked, full points will be given in the question and answer round.
Members cannot ask questions from the member of the same team. I would like to remind the judges again that exceeding the 2-minute time limit would lead to deduction of marks, and if no questions are asked to a participant in the question and answer category, they'll get full marks.
Can we please have the sound of the first buzzer that will ring at 1 minute 30 seconds? And the final buzzer that will ring at 2 minutes? Okay.
Thank you so much.
Now, without further delay, we would like to invite our first participant from batch 2021, Abhishek Gupta, who will be speaking for the motion.
A very good afternoon and my heartiest welcome to all the members of the House. My name is Abhishek Gupta from batch 2021 and I'll be speaking for the motion. Just so we're on the same page, I'd like to inform you what AI really is. Artificial intelligence, as the name suggests, is the simulation of human intelligence processes by machines, more specifically computer systems. When I say human intelligence processes in medicine, it includes the ability to assess the patient from head to toe, perform the necessary clinical examinations, and most importantly, arrive at a diagnosis. It also includes monitoring the ADRs. This is what AI in medicine would mean. Just envision for a minute that we feed in all the data in the world about all diseases, all their manifestations, all their medications, all their complications. Wouldn't that system be able to diagnose better than us mere humans who can't possibly memorize all that data? I understand that to some minds, this idea may seem nothing less than ridiculous. But I reckon so did the idea of the first surgery. We're already so dependent on machines. Almost every equipment that we use is closely related to computer systems, MRI, CT scans, USGs, everything. And the reason why we rely so much on these machines is because of their accuracy and precision, right? We make our diagnosis on the basis of these results. It would be the most foolish and narcissistic thing to believe that we humans have more accuracy than machines. And in a country like ours, where we have a shortage of doctors, where the majority are overstressed, imagine an integrated AI system which can diagnose, which can detect the earliest symptoms of a disease, where no more second opinions are needed, which can reduce the number of emergency cases, and the best part, uniformity in prices. AI can eliminate the wide range of charges that different doctors take. Imagine a world where no more deaths occur due to human negligence or human incapability. In such a world, even the workload on students can be reduced. And yes, emotions are an integral part of humanity. And my opposition may argue that a patient will always feel more comfortable when it's another human being counseling them. And therein lies the solution. Let the humans counsel and let the AI do the heavy lifting. People are always afraid of change and things that they do not understand. And fear is the arch nemesis of innovation and progress. In the end, I'd just like to conclude by saying that in a profession like modern medicine, we should definitely prioritize those which have more capability, be it human or artificial intelligence.
Now I would like to request the participants to raise their hands to ask questions for the rebuttal round.
We all are taught that doctors start observing their patients the time one of them enters their clinic. And they judge the patient by the way they are talking, by the way they are walking, by the way they are interacting with the doctor. And your AI will judge a patient's disease only with the information that is fed into the computer. So how will you justify this?
Thank you for your question, ma'am. But when I say we feed in all the information, that includes the ability to walk, all the gates, and the only limitation we face right now is the technological limitation.
Now, we would like to invite Shri Gopal from batch 2021, who will be speaking against the motion.
Greetings to the respected judges, faculty members, and the dear audience. I am not afraid of admitting artificial intelligence into medicine, but I am mortally terrified of admitting artificial stupidity into a field where the lives of people hang into the balance. My opposition here, if they've done their homework, would cite examples like the 2017 case where Dr. Esteva et al. Developed a DCNN model to classify patients into either seborrheic keratosis or keratinocyte carcinoma. Or maybe they'll give examples of the Google's prognosis tool for diabetic retinopathy. But instead of being awestruck by all these big and fancy words, let's just scale it down and read the full research article where Dr. Esteva himself states that distant and blurry images were used while training the AI. So can we really use such AI tools which have a suboptimal training capacity? In the 2019 conference for artificial intelligence in medicine, Dr. Anthony Shank stated, and I quote, that should AI be admitted into the medical field, then the clinicians will have to be trained into data science. In a country where we are already overburdened, in a country where people are still dying of vaccine preventable diseases, do we doctors really have the time to train into data science? And then there's the argument that AI can revolutionize data processing or storage. But I would like to draw your attention to the case last year in November when there was a data breach in AIIMS Delhi where the patient data was stolen and kept ransom for 2 weeks by the hackers. And if such a thing happens again and we do not have manual records by that time, then who will be responsible for the patients who will die and then? And then some people will cite that they'll say that the advent of AI in diagnosis or surgery is a huge innovation. But can a heartless AI really replace the values which we learn in our AdCom sessions? Just think about that and think about artificial stupidity, which can cause more damage. The next time an emergency case rolls into your trauma center, you need to decide that whether you will be entering data into a machine or whether you will be saving the life of a patient who's bleeding out on the table. Thank you so much.
Now, I would like to request the participants to raise their hands for the rebuttal round.
Shri, you spoke really beautiful. But don't you think ki a pathologist would be very happy if all the data in the all the data related to all the tumor markers that are present right now in the human body are fed into a machine, and if they put the data of the patient's lab test and it gets the result, won't a pathologist be more happy and more contained? Will the result won't be more pronounced and accurate? What do you think about that from a perspective of a pathologist?
Thank you so much, ma'am, for your question. Ma'am, I would just like to say that the image that we see in our pathology books, I think that Dr. Kiranpreet ma'am would agree would never match the microscopic slide that they see. There's always some variation, and that variation can only be justified by the experience of the clinician. That whether there is a range of the variations, so that will be judged by the clinician better than the AI. That is my opinion. Thank you for your question.
Our third participant for today is Spicy Shakya from 2020 batch, who will be speaking for the motion.
Artificial intelligence is not a substitute for human intelligence. It is rather a tool to amplify the creativity and ingenuity of human minds. Good afternoon, honorable jury members, people speaking with me in this debate, and my worthy opponents. Today, I, Paisi Shakya from batch 2020, is standing before you to express myself in favor of the topic, Artificial Intelligence in Medicine, a Welcome Change. Before starting the debate, we first need to understand what actually artificial intelligence is. So an ability of a computer to do human activity is what is artificial intelligence. A computer or a robot controlled by a computer doing all the tasks that are done manually by a human. Now to the first question, that is artificial intelligence a welcome change in medicine or no? So in my point of view, yes, it should be a welcome change in medicine. In my point of view, AI in medicine is a tool which will help doctors and all the healthcare workers at all the levels to improve what is going on in the Indian medical fraternity. AI provides real-time data for diagnosing and addressing the medical issues. With AI, doctors and all the medical professionals are at ease with what the data they have. Imagine a pathologist working very hard to get all the tumor markers correct and at point to diagnose a cancerous disease. But what if the pathologist misses any one of the tumor marker? Won't it lead to the diagnosis misread? The question is, we need AI to improve what the conditions of doctor in our country is. We need AI to mark and engage more patients in the process. With AI, we can also involve patients in their whole process. That's the ending I would like to say, and I would conclude by saying what Sundar Pichai has said. AI is inevitable. We cannot remove it from the system. We need to include it and we need to improve it. Thank you.
Now, I would like to request the participants to raise their hands to ask questions for the rebuttal round.
Ma'am, first of all, I congratulate you on such a speech. And ma'am, secondly, I'd like to ask that every minute in India, 3 people die of tuberculosis. That's the data of 2021. And in such a state where people are still not completely comfortable but even doing online transactions, do we really have the time to train all our clinical practitioners with the intricacies of data science or how to exactly put the data into the machine so that it can give a convenient diagnostics?
I don't think in my point of view, a doctor himself or herself should be sitting on a computer and doing all the work. I absolutely agree that a doctor should be sitting in front of the patient, judging the patient, whatever his or her condition is. There are a lot of people other than the doctors, like lab technicians, a lot of people we can right now train to activate all these systems. We can increase our employment with this in that way. We are dealing with 2 problems right now. We are increasing employment and we are helping the doctors to improve their own conditions. So in my point of view, I think, yes, I absolutely agree. If people are scared with online transactions, I don't think they'll risk their health to it. But we need to change this thought. We need to change this mindset. That is what this debate and this whole discussion is all about. We need to improve what AI is all about. So I guess that's what.
Thank you, ma'am.
Yeah. Thank you.
Now, I would like to invite our 4th and final participant of this debate, Kritika Gupta from 2020 batch, who will be speaking against the motion.
Years of training, intuition refined, a doctor's accurate diagnosis surpassing AI's mind. AI's reach expands, I agree, but let's be clear. Human touch and empathy, no machine can steer. A very good morning to one and all present here. I am Kritika Gupta and I stand here firmly to speak against the notion. First of all, just imagine a battered woman walks into the hospital with torn clothes and a pitiable state. According to you, what is the first thing that should be ethically provided to her? Obviously, emotional support and counseling. I would like to ask my dear worthy opponents, can you name a single technology in this world that can provide comfort to a patient by building trust and paying attention to the individual needs of the patients? Now, let me draw your attention towards a very recent news report, according to which over 500 doctors competed for merely 20 seats of a non-academic junior resident at a very famous government hospital in Delhi. This clearly proves that there is a huge scarcity of job opportunities for doctors. And advocating the increase in use of AI in medicine will only worsen this distorted ratio. Haven't we all seen our pediatric doctors struggling hard to distract their pediatric patients or infants while giving them their vaccination shots? Do you really think any bot in this world will put efforts to such an extent only to ensure the comfort of their most vulnerable patient, that is, the pediatric and the geriatric ones? Finally, I would like to say that no technology in this world can replace a doctor holding patient's hand while telling a life-changing diagnosis or the proficiency with which he or she starts observing the patient once he or she enters the clinic. Thank you.
Now, I would like to ask the participants to raise their hands to ask questions for the rebuttal round.
Congratulations on such a beautiful speech, ma'am. But I have one question. Have you ever not felt helpless in front of a patient? Like suppose a patient is bleeding too much, or suppose you know that you can't help the patient because you have not yet studied that topic that perfectly and there's no one around to help it. In that moment, would you prefer giving emotions to his family for his death or let the AI do the work?
Thank you for your question. But if I am not able to deal with a patient, this means that I am not capable enough and I am not worthy enough of still being able to treat that patient. This does not mean that this is a drawback in the system or there is a drawback in the conditioning or the training of doctors. There are superior doctors and it is a drawback on my part. It is a weakness on my part that I should train specifically and accordingly with what my patient comes with. Thank you.
Let's have a huge round of applause for all our participants.
And now it's time we request our judges and other faculty members to express their views on this debate.
So thank you so much, first of all, for inviting us to judge the event. Otherwise, I may have missed this, interesting debate. Topic was really, apt and, so in. Like even we debated in our department. And just for your information, we do have a machine with a lot of AI in our department. So why was only pathology being quoted? That is okay, no offense taken. So very interesting topic, very well presented. And I just want to tell the participants that, the title was like AI as a welcome change, not replacing doctors. So maybe some of the participants, got carried away and they were like replacing doctor with a bot. But I think that was the fun part of it. So I really enjoyed the debate. Thank you so much.
It's an honor to have you here.
So again, thank you for inviting me to judge this event. According to me, next time, 2 minutes is too less. If you have only 4 participants, it should be at least 4 minutes, 5 minutes, because just introducing the topic takes half minute to 1 minute.
Yes, sir.
So most of them just fumbled while you were just ringing bells, no? So it should be a little more, right?
Sir.
So let's say, if I can add a couple of things to your debate, why probably you quoted pathology was because you are currently doing pathology this year and you're maybe happy with the way the pathology teachers have been teaching you, you're impressed. But
Definitely,
just imagine
ma'am.
the scenario we had during COVID when we were teaching you online. We didn't even know whether you were there or not. Everybody was sleeping. So if a bot is teaching you, what would happen? So one thing, nobody's mentioned what happens to education when AI takes over. Completely, that is. Second thing, as you talked about pathology, yes, we have a hospital information system, but what happens if that crashes? If we lose the data, we are nowhere. So both ways, I think cost, data security, and thinking of emotions, even just not while treating, but also while teaching doctors is important. So very good, congratulations to all of you. Very happy with your performance.
Thank you so much, ma'am.
Congratulations for a very well presented debate. Like Sir said, it was too less. 2 minutes is too less. At least 5 minutes should be the adequate time for that. And basically, like ma'am said, you did use emergency medicine as an example also. And I might be biased in that, but I do feel like ma'am is to, like she said, I too also feel that doctors cannot be replaced by a bot. But that was not the topic, basically. It was an add-on tool, maybe, to supplement the education system for us. Thank you.
Thank you, ma'am.
Congratulations to all of you, first of all. I think the aftermath of yesterday's inputs that were given during Hindi debate, it is still there. Because most of you, ma'am, I'll just like to brief you. Yesterday in the Hindi debate, what happened? They all just Googled and came. And so the effect of artificial intelligence was evident in their Hindi debate. It was told that you have done less research. So they did research, but it's better than yesterday, much, much, much better than yesterday. And today, all of you have researched it,
But as ma'am has pointed out really well, that you have to actually stick to the topic and understand what is the objective of this topic. And then if you go on to put yourselves in that minimum amount of time, then you will not losing your time in giving introduction, or possibly you will not wasting your time in going haywire either and other. You know what is actually happening? You are taking artificial intelligence is replacing everything. No. Once and for all, remember, it is a human who generates an artificial intelligence. It is a human who runs an artificial intelligence. And without humans, the artificial intelligence would be like, you know, rocketing to moon, but not knowing where to land. So there will always be a crash landing. And nobody has taken up this point anywhere in the debate, that what is the input of a human in the artificial intelligence. So that is what the point was to be made with this topic. Okay? Thank you. All the best.
That was very well phrased, ma'am. Thank you so much.
Now, we would like to welcome all the judges on the stage and Kiranpreet ma'am and Pooja ma'am to announce the winners.
We have our scores here.
So thanking all the three wonderful judges for their inputs. So there are two prizes, I guess, one for for and one for against. So for Payasi Shukla, Shakya, and against Kritika Gupta. Congratulations both of you.
Boys were good too, but sorry, girls take the cake. Congratulations.